In 2016, after Nigeria was officially declared polio-free, 2 children from the Lake Chad Basin were diagnosed with polio. The children came from areas affected by years of conflict and large population movement. The global health community knew people had been living in areas inaccessible to vaccination efforts and hidden from surveillance teams. Genetic analysis quickly revealed that the polio virus had been circulating in the area undetected for 5 years. The science of polio surveillance must constantly adapt to pursue this virus. For most of human history, polio was largely invisible. Our ancestors could see fever, withered limbs, and paralysis, but not the invisible virus that was all around them. 3,600 years ago, Egyptians created a tablet showing a priest with a withered limb walking with a staff. And 1,000 years later, Greek physician Hippocrates described a similar paralysis of the legs. It wasn't until 1773 that the first detailed case of polio was recorded by Sir Walter Scott's childhood doctor, who described his symptoms as a teething fever. But Scott's own memoir documented something much worse: a permanently withered leg. Polio circulates largely unseen. Most people who are infected have no symptoms at all. Only a quarter of those infected will ever present flu-like symptoms. Only 1 in 200 will share Sir Walter Scott's fate. These acute cases are still important in modern surveillance systems. They are a good indicator of where the polio virus is circulating. Health workers in hospitals and clinics evaluate and report suspect cases. If the wild virus is identified, further tests are carried out to determine where the strain originated. In areas with few formal health workers, a parent will bring a child showing signs of paralysis to anyone, to find help. Religious leaders, pharmacists, traditional healers all serve as a source of information. In conflict zones, where there is no surveillance, health workers remotely examine children by video conferencing over a smartphone. Health workers also test those who flee to see if they are unknowingly harboring polio. This approach has had stunning effects in Pakistan, where cases have been reduced by more than 90%. Looking for the virus in humans is effective, but environmental testing can find the polio virus hidden in regions where there are no active outbreaks. In 2013, routine surveillance revealed polio in Israeli sewer systems. The government responded with a massive effort, immunizing 980,000 children in just 7 months. Not a single case of polio was reported. When Brazil hosted the World Cup in 2014, routine surveillance found poliovirus in a sewer system connected to the airport in Sao Paulo. Genetic sequencing traced the virus to West Africa. The traveler likely never knew they were carrying it. Brazil had ensured herd immunity through continued immunization, preventing an outbreak even while polio was circulating in the environment. Today, surveillance teams are using technology to search not just Nigeria, but the entire region to reveal where the virus may continue to circulate and threaten progress towards eradication. There are thousands of people involved in surveillance worldwide, working in the streets, in labs, health centers. Surveillance is the way forward. Eradication requires finding all traces of polio.